happy to be here today. I'm Jeff Case. I'm a clinical psychologist. I earned my PhD at Brigham Young University and have spent my career working within the military population. I was an Army psychologist for 8 years. Coming out of grad school, I did an internship at Fort Lewis, Washington, and worked with a lot of combat troops that were coming in and out of Iraq and Afghanistan. 06 to 08, these were years that were very heavy within those armed conflicts, and I got a kind of a taste of what it was like to work with this population. As an active duty psychologist, though, I was really intrigued by the culture of the military, and looking forward to kind of serving more deeply. So my first assignment coming out of my internship was in Germany, and I was assigned to an infantry unit as their behavioral health officer. Spent 3 years with them, and part of that was a year in Iraq, working as a behavioral health officer with an infantry unit in Iraq. And the role of that was partly treatment. So I worked with just doing good old-fashioned psychotherapy in a tent near Baghdad, but also consulting with command and as a behavioral health expert, talking with command about different behavioral health topics and making sure that they were taking good care of their troops. After that, I was given a postdoc fellowship appointment for a postdoc fellowship in trauma, suicide, and resiliency. Completing 8 years in active duty was enough for me and my family, so separated from that, and I've been working within the VA and the veteran community ever since then, and it's been my joy to work within the veteran population.
So Jeff, could you explain to our audience a little bit about your veteran story?
Yeah, my veteran story actually begins the day I was born. My father was in basic training when I was born, and in the Air Force. And so I was raised a classic Air Force brat life. He served active duty Air Force for my entire growing up years and didn't retire from the Air Force until about a week before I got married.
Oh, wow.
So I spent my life on Air Force bases and around the military population my whole life. I came out west to go to college, and immediately needed some financial assistance. And my dad, being an NCO with 6 kids, I knew college was kind of up to me if I wanted to afford college. Well, my sophomore year, one of my roommates said, "Hey Jeff, I've been talking with the recruiter, and there's actually an Army band that we can join." So my roommate and I were both musicians, both music majors, and he's like, "There's a recruiter. He's got this band," and I'm like, "Matt, he's lying to you. There's no band. You're going to show up with your trumpet one day, and he's going to take your trumpet and give you an M16 instead," right? Because I didn't imagine myself, of military metal, I suppose. Anyway, he talked me into it, and the two of us went out to West Jordan, where there is, in fact, an Army band. They're now in Lehigh, actually, but the 23rd Army Band, great organization. We auditioned. He ended up not joining, but I did. I thought it was great. Thought it was a lot of fun. And that summer, I found myself in basic training at the age of 21.
Wow.
And so I came into the military as a musician, and really started to develop a love of the military culture kind of on the inside. And in fact, it was really in basic training when I first started thinking about what kind of the human side of the military. I saw people that were really thriving in that environment, and I saw people that were really kind of crushed under the weight of expectations, and then a whole bunch of people kind of in the middle that were just doing just fine. But I'm always interested in like the on the outer skirts of the bell curve of human experience. And so even though I was studying music and I had aspirations to become a band director, all of a sudden my interest in like people became really piqued. And that's
So as a psychologist, could you explain some of the generally unique factors about mental health and veterans?
Yeah, veteran mental health is a really interesting place to be. First of all, I want to kind of talk about some of the unique things that do occur within the mental health world within veterans, but also kind of recognizing that the veteran population is a very diverse population. That we tend to look at groups that are different from us as all being sort of the same. The technical term for that is outgroup homogeneity. That groups that are different from us, we see them as all the same. That within racial groups, we see all African Americans as the same, or white people are all the same, or Catholics, or whatever the out group is. We see people as the same, but within the group, you understand that and you appreciate it for its diversity. So there's a temptation to view veterans as all kind of the same based on a stereotype, right? The crazy war vet, or wearing flannel, loving guns, being super patriotic, and there's a lot of truth to some of these things, but within the veteran population, we know it's a very diverse group, because the military population is sort of a microcosm of the population at large. Very racially diverse, religiously diverse. It draws on LGBTQ population. A high percentage of transgender individuals serve in the military. We know that it represents, it does skew largely towards the male population. It's about 85% male, 15% female. So it is a more generally male, but there are quite a lot of female veterans as well. So when we say vet, we usually think of a male, but we want to make sure that the females are also appreciated. There's a large number of female veterans. Within the mental health community of veterans seeking mental health care, it's also very diverse. People assume that if you've gone to war and you went through traumatic experiences, you must have PTSD. That's also not true. We know that through research, about 20 to 30% of wartime vets are diagnosed with post-traumatic stress disorder. There are a lot of other things that can come from that. So people may experience depression or substance use disorder, but the largest percent of people who go to war actually experience resiliency and growth. And so for a big part of the population, I want to recognize that they don't in fact have mental health problems. So we look at resiliency as the ability to kind of bounce back to your previous state. So resiliency is just kind of coming back to kind of where you were before. I mean, obviously you've seen things and done things. You're not going to go back fully to how you were, because you may have lost naivete, you may have lost your worldview, in some ways has changed because of what you've seen. But generally speaking, how you kind of function, your emotional experience, your behavioral experience goes back to kind of your set point, your personality, the traits that you carry kind of long term end up being about the same. And that's true for the biggest percentage of people who go to and experience combat. The growth indices are really interesting, because growth actually can come with really the more severely traumatized individuals, and growth also occurs with people who experience post-traumatic stress disorder. So growth and disorder don't have to be exclusive. In fact, a lot of times they co-occur. And I want you to picture the hobbits in the Lord of the Rings, right? They went through, the 4 hobbits that left the Shire went through some really traumatic stuff, and experienced some pain and things that they're going to carry with them the rest of their lives. But when they get back into their normal society and normal culture, they are stronger. They have a lot of factors that are not found in the other hobbits who never left the Shire and didn't experience trauma. Within the general spectrum of mental health things, we find not just PTSD, but we also find a wide range of mood disorders, including major depressive disorder, bipolar disorder. We find anxiety disorders, generalized anxiety, obsessive compulsive disorder. So really, the more I work within the veteran population, I realize that we have a broad spectrum of mental health struggles. PTSD, again, being a really big part of it. And it's an area that for sure anyone that wants to work within the veteran population needs to become really very savvy with working with trauma, but also recognizing that just because you went through trauma doesn't mean that you necessarily have PTSD. Yeah, so within the veteran community, like I said previously, there is a lot to be understood with the diversity in the veteran community. Again, we're not all the same. And I think you're going to find a broad spectrum of religious views, of political views, racial identities, LGBTQ plus individuals within the veteran community. So I would always, when you're entering into the veteran space, make sure that you're asking good open-ended questions and understanding what that veteran's experience is, because they may represent one of the smaller groups. While there is a large segment of the veteran population that is sort of very similar, right? Like high levels of patriotism, often conservative political views, dedication to family and country. There are other groups within that may look a little bit differently. And so it's important to recognize that there are diverse areas within the veteran population. But we're very kind of a tight-knit group of people. We have each other's backs. We're loyal to each other. Within the veteran population, though, you have people who served in different branches of the military: the Marine Corps, Army, Navy, Air Force, Coast Guard, and it's kind of like siblings, right? We kind of make fun of each other. Like we can make jokes about what Marines are like, or the Navy or Air Force. But if an outsider makes fun, we'll kick your butt. We're not going to tolerate that. Like we will band together, but we can rib each other and make fun of each other and use derogatory terms. I'm not going to use them today to give anyone ammo, but I think y'all know what I'm talking about.
Yeah.
But we can do that because that's what siblings do. But don't come at us, because we'll take care of business, right? So I think within the veteran culture, you're going to find a bunch of people that we tend to have a bit of a dark sense of humor. We've been to places that are a little bit darker, and consequently, our humor may skew a little bit. So sometimes, my wife has to remind me, that's not a good story, Jeff, for polite society. And I have to be careful with what stories I tell. So some of the shifts that have kind of come have to do with things that you'll kind of see in the broader culture as well, because again, the veteran population is sort of a microcosm of the bigger culture, and so you see different views in how they kind of see the government and politicians, right? I think a big difference from our Vietnam brothers and sisters. So a grave error that occurred within our nation history that we're still kind of atoning for is that the Vietnam War, very unpopular within the citizenry, the citizens took that out on the veterans and the soldiers themselves. And that created a great betrayal towards the veterans, betrayed by the people that they were fighting for. Vietnam veterans understood that trauma can occur in a war zone because there are bad guys in a war zone. But when you come home and you survive that, and now you have institutional betrayal, the trauma of coming home and being thrown under the bus and being spit on and called baby killers and all this by the citizens that you were fighting for, created a great sense of trauma from that culture. And so there was a huge cultural element to the Vietnam vets that included institutional betrayal that was committed by the citizens of the country for being blamed for the war itself. There was a great shift as the Iraq and Afghan war vets are coming back, and I would say actually the Gulf War vets, what happened there was largely ignored. They didn't get fanfare, nor were they spit on. They were just like, good job. No, nothing happened, right? And so that was a cultural interesting thing that kind of happened there. They were just kind of left to their own devices, neither fanfare nor negative consequences like the Vietnam vets. When the vets from my war were coming back, it was thank you for your service. It was a lot of praise. In fact, as I was coming out of Iraq, I took a 2-week R&R. I was coming back to the States to visit my family, and when our plane landed at the Dallas airport, there were fire trucks on the runway that were hosing down the plane to symbolize the hero's welcome. And as we came through that concourse, we were announced, and everyone was on their feet and clapping, and people were throwing their cell phones at us. Call your wife, tell her you're home and you're okay, and they were giving gift baskets and goodie bags, and it was quite frankly quite overwhelming. And all I could think about was what a difference that would have made if the Vietnam vets had had that. And a lot of the Vietnam vets were the ones that were there offering us that homecoming.
Wow.
And so there was a huge cultural shift and consequence from that, and that sense of gratitude. The war was equally unpopular, but they took that out on the politicians and the people that were sending us off to war, not the people who were fighting the war. And consequently, the shift from that I've noticed is that there doesn't have to be that sense of recovering from the moral injury, that institutional betrayal that the Vietnam vets had to had to go through.
So, with veterans having different experiences with different wars, and then coming back and having the public, the American public, responding to them in different ways, what impact to mental health have you noticed with the various groups of veterans themselves?
Yeah. So let's talk maybe about the Vietnam vet, because one of the things that we've had to kind of go through in treating Vietnam veterans is working through the institutional betrayal in addition to the combat-related trauma. So it's been a couple of layers of things that we have to unpack and peel back, and more complicated. I would say one thing that's interesting within the Vietnam vets is we've had a lot more success with groups, because the Vietnam vets really had to rely on each other because they couldn't rely on anyone else. And so our Vietnam vets, the ones in our area here in Utah, have really banded together and have this really tight, cohesive brotherhood. And I think that might be maybe an artifact of the abuse they experienced when they came home, because they had to rely on each other. They had nobody else. With the Iraq-Afghan vets, we've tried forming groups, and we've tried to bring them together, but they haven't been ostracized in that same way, and so it's been a bit more difficult. So I think that's kind of an interesting maybe phenomenon within that Vietnam vet population. So with the vets today, with the Iraq-Afghan war vets and the Gulf War vets, we can kind of more focus our treatment on just the events that happen downrange, and talk about those traumas. And we haven't had to do too much work with the institutional betrayal of our culture, except perhaps with just the politicians themselves, like the going to war and some things that came out with Afghanistan, and knowing what we know now about what they knew about Afghanistan and with Iraq, all those things. We're having to kind of work through that, but we don't have to work through the betrayal of the culture at large. And so it does kind of impact things a little bit differently.
So it sounds like there is a correlation between the way that the veteran is received when they come home and their ability to be resilient from their experience as a soldier. Is that true? Is there a correlation there? It's easier for them to work through the problems that they face from coming home when they're received better.
Oh, absolutely. Yeah. So if a veteran is received in a more loving, open way and given space and given kind of time to work through things, and they're going to have a much more positive experience kind of in the long run than if they kind of come back into a hostile environment, because then they don't have the ability to kind of process. Like I would say in large part, we know that the brain actually is pretty good at processing difficult experiences, even processing trauma. What happens is when we get in the way of that, we don't allow that processing to occur naturally, we box things up and don't want to deal with it. We push it into the back of our brains. Here's a classic example. A Vietnam vet told me about coming home to Utah. And he's from Cache Valley up in Logan, small community at the time, very insular. He had come home and he started sharing some of his experiences of Vietnam to his mother. Her response was, isn't it enough that you lived and you survived? We don't need that negativity in our valley, so please don't bring that into our home. And he was forced to box everything up. And so he did. He boxed it up, put it in the back of his brain, and wouldn't allow himself, didn't have a space to talk through and process his experience. And he went to work, because that's what they did. They went to work. He worked hard, 50, 60, 70 hours a week, to avoid having to talk about that box in the back of his brain. And upon retirement, knock, 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 the box said, hey, we've got some talking to do, and everything came spilling out 50 years later. And I'm glad that I was there and was able to kind of talk him through it. And we emptied the contents of that box, and we kind of worked through it. And it's more difficult that far down the road. But I wonder if things would have been different for him had his mom says, you know what, let's talk this through. Because when we were able to kind of talk through things in the moment, they don't become infected. They don't become these little cancerous things in the back of our brains that can really start seeping out into all areas of our life, right? I think after like 9/11, it's a good example. Culturally, we experienced the collective trauma, and it was all over the news, and we talked about it nonstop. The news reported on it kind of nonstop, and we chewed and we chewed and we chewed. Now, I will say there are people that for 9/11, they experienced some very personal trauma, and they weren't able to experience the collective processing. But for those of us maybe that were just as kind of culturally processing it, we could do that. We kind of culturally processed it and talked about it. And then we were able to kind of put it to rest and integrate that story into our overall tapestry of our lives and kind of put it where it belonged, because we could process it, even though it was very traumatizing and kind of a big deal. And that's kind of the work we do with trauma, is we need to really kind of process it and talk about it. So if a person is kind of coming back and we allow them space to tell their stories and get it out, and process it, the less likely it becomes this thing, this sore spot in the back of their minds that we then in therapy have to kind of extricate and pull out and cleanse later on.
So this discussion leads my mind to this place of stigma. What are your thoughts about veterans and the stigma of actually accessing and being open or feeling comfortable seeking mental health care?
So the stigma is one of the big things that kind of has made it difficult for veterans and to seek healthcare, because the stigma of feeling weak, or I can't handle this on my own, or I should be able to take care of my own stuff. So the stigma kind of prevents people from coming in and talking because of a perceived sense of weakness. I think we've done a lot of work in trying to overcome that stigma, that, kind of breaking down is a sign not of weakness, but a sign that you've been holding on and been strong for too long, right? And a lot of ad campaigns, and we're really kind of working to kind of break this down, but there is this sense that it's kind of a weak thing to kind of come in and seek care. I was working with a very senior ranking sergeant once, NCO, he was a command sergeant major, which is really kind of top of the food chain for the sergeant world, for the NCO world. But he would only come and see me, even though he was still active duty, in civilian clothes, because he didn't want to be seen as weak. And then one day he came in full uniform to a session, and I'm like, "Hey, Sergeant Major, I noticed you're in uniform today. Why the change?" And he said, "Well, last week there," and I won't use his language because this is for public consumption, very salty language. He said, "Well, last week in the waiting room there was a colonel who had the balls to come in here in uniform and wear his rank proudly and sit in your waiting room. And if that blank blank officer had the blank blank courage to wear his uniform, then so do I." Right? Great, that's awesome. Right? So he's like, maybe wearing a uniform and showing the younger soldiers that it's okay to get help I can be a good example for them. And I'm like, bravo. Because this guy before, he really saw it as a weak thing. And I think more and more we're seeing the senior leadership in the military and then the senior leadership within the VA really kind of pushing to say it is okay to get help. And we all need help along the way. I'm a psychologist, and I've seen a number of therapists over my career because these things are hard, and it's important to talk and take care of ourselves and to talk through it. So I think it's important to talk about the stigma and address that. And I would say culturally and generationally, we're doing a good job of moving that along, and the younger generation are feeling less and less stigma about getting help and saying, yeah, so what? Seeing a therapist is the same thing as seeing a dentist, right? The brain is part of the body. It's not different. It's just another organ, right? If your heart goes bad, you go see a cardiologist. If your stomach is bad, you go to your gastroenterologist, right? And if your brain goes wonky, you go see a therapist. It's another organ, and it's in fact the most complex and least understood organ. So why do we expect people to be able to take care of it on their own? The main stigma, I think, perhaps occurs at the very beginning in the recruiting station, because we weed out people that have pre-existing conditions from coming into the military. And so people often will not disclose mental health conditions on their recruitment paperwork so they can come into the military. And so they start out by hiding. I've heard countless stories of people saying, yeah, I saw a therapist, and the recruiter saying, we're going to throw that application away, and I lost it, and I need to have you fill it out again. And this time, don't put down your depression. Don't put down that you were on ADHD meds. So right from the beginning, we're telling people to hide pre-existing conditions. And I understand to a point the need to have a fit army or a navy, fit military, right? That we don't want people that have bad knees or bad backs. Like, we need to make sure that people are coming in to a standard where they can kind of function. And I understand that, right? But there's also the stigma of that if you have depression, you're not functional, right? That you may have, given the fact that mental health exists on a spectrum, a lot of people have mental health conditions and are operating and functioning really well in our world, right? So I can kind of see both sides of the story. We want to make sure we have a high-functioning military, but we're telling people right from the beginning to hide these things. And then throughout your military career, you're told that if you have or develop a condition, you might get kicked out. You might lose your security clearance for disclosing a mental health condition. Okay. You might lose your flight status if you're a pilot. You might lose your deployment status. You can't deploy if you're on a sleep aid in some cases. And so people don't get help because they don't want to lose out on opportunities, because they want to serve. They value serving. They want to go do their job in a combat zone because that's why they joined. And so they fear disclosing for fear of missing out on what they want to do. And so the stigma starts right at the beginning and goes through their military careers of hiding. And then what happens is, and this is what I would tell people when I was serving in the military, coming in to see a mental health provider may actually be beneficial, right? Because coming in to see me for depression, I'm going to treat your depression and get you back on your feet and keep you serving, right? You won't get kicked out for seeing me for struggling with your marriage or struggling with anger problems. But if you don't come see me and you can't manage and you can't function and you start using alcohol excessively and you get a DUI, or you start beating up your wife or kids, or abusing illegal drugs, those will end your career. But seeing me won't. And we tried to really instill that idea about getting help before the problem becomes so big that it will impact your life. Or it will impact, and so within the veteran population, come and see me before you get a DUI, before you get an arrest record. And further stigmatize the veteran, the crazy vet stereotype that abuses substances, and all those stereotypes that we kind of perceive. Come and get help before all that stuff really breaks down, because mental health is on a spectrum. Come and get help when the problem is small, so it doesn't become a really big thing. Get your oil checked on your car before the engine breaks down completely. So we want to destigmatize it, so it's okay to come in and get help before the problems get so big that it becomes unmanageable and out of control.